And welcome back. Well, people with disabilities or special needs often have limited means and require assistance from healthcare services and community resources.
Our next guest offers a very unique approach to care management that covers medical, dental, behavioral health, vision, as well as social services. Dr. Thomas Lutzow is here with iCare Independent Care Health Plan with more on how all of this works. Great to meet you.
Thank you. Thank you. Nice to be here.
Let's talk a little bit about iCare. What makes it unique?
Well, it's a Wisconsin plan. We began here in Wisconsin. iCare was formed by the Milwaukee Center for Independence in cooperation with Humana Health Plan. And MCFI has been around for 80 years in this part of the country, working with people with special needs. And this was an effort to build an insurance plan for those people. It was funded by the federal government, actually, as a demonstration program 25 years ago. And to this day, it continues that mission. So we're quite pleased with it. Just last week, U.S. News and World Report listed iCare as one of the best plans in Wisconsin. So we're quite pleased.
Awesome. Huge accolades.
Yeah,
so
congratulations.
Is it open to everyone, or it's open specifically to someone who has a disability or special need?
Anyone who is eligible for Medicaid and Medicare. You can be eligible for Medicaid only, or there are many people that are part of our plan that are eligible for both.
Okay.
Talk to the specifics of how the care coordination model works.
Care coordination starts with an assessment of need, and that is not just medical need, it's also social service need.
Okay.
And then a plan of care is built to try and solve those problems. An example that I frequently refer to, one of our members is a Vietnam vet, disabled in a wheelchair. We noticed that this person was visiting emergency rooms quite frequently. So we went to his residence and found that he lived above a bar, and there were 20 steps from his residence down to the street, and he had a problem navigating and injured himself frequently. So what we did is asked him if he would like to move to something safer. He said yes, he'd like to live on the east side. So we managed to find a place on the ground level that was within his means. And again, if we hadn't solved that problem, which was basically a social problem, we couldn't have gotten to his medical needs.
Absolutely.
So frequently we have to deal with social issues before we can start.
Almost like a lifestyle issue.
Yes, it's frequently.
And what's so wonderful about the example that you just gave, because I think it's a wonderful example, is talking about improving the quality of someone's life.
Yes, and frequently, you know, we view ourselves as our members' best friend. You know, they get calls from people wanting a contribution to a campaign, or to sell magazines, or for a rent check, or possibly something else. Maybe a relative wants to borrow money. When they get a call from us, it has nothing to do with that. It's like, how are you doing, and how do you feel? Is it time to see your doctor? Do we need to do something with a mammogram, or something of that sort? So we get involved pretty closely with our members.
That's really great. What are some of the additional benefits that you offer to members?
This year, some of the benefits that we're introducing are Weight Watchers. You mentioned the free cell phone. We're excited about that. Silver Sneakers, which is an exercise program. We have also introduced a lot of remote monitoring devices. These are Wi-Fi enabled devices. As people age, sometimes they lose their memory, and even staying on medications can be a challenge. So one of the tools we have is a Wi-Fi enabled medication dispenser.
Oh, nice.
Awesome.
So you know when it's time, or if you've taken the medication?
The dispenser portions out the medication that needs to be taken that day, and we can tell remotely whether an individual is actually taking their meds or not. So, and if they skip a couple of days, we can visit the home and find out what's happening.
And you work with providers too.
Providers are very important to us, and we view our care coordination model as sort of an extension of the doctor beyond the office. Very often, you know, we're concerned. We know when a prescription's been issued to to our members, and the important thing is that they adhere to the medication regimen, and so that's one of the things that we're concerned about. This year we will do 2,500 home visits where we actually send a nurse practitioner into the home and do a complete medical workup and share that with the doctor. So
great.
We are very, we value our providers. They're extremely important and trying to extend their effect.
Congratulations on an amazing model and something that's really improving the quality of someone's life. iCare members who qualify for Medicaid receive a free refurbished smartphone. That's incredible. And people should get in touch with you. You have a toll-free number. It's 866-939-9472 for more information about truly the extra benefits that are available at iCare. You also have a website that we have there on the screen. Thank you so much.
Very
Thanks,
good.
Dr.
Thank
Lutzow.
you.
Appreciate it.